Anxiety, depression, and loneliness are some of the most common mental health concerns in our world today. But in our culture of comparison, we often feel like we're the only ones struggling, and so we try to just avoid or shove down those uncomfortable emotions. But when we do that, we're denying our needs, and research shows us that avoiding our emotions actually makes our experience of them worse. Hi, my name is Anna Males. I'm a licensed therapist, and today we're going to learn about depression, anxiety, and loneliness. Get curious about what they're signaling to us about our needs, and then respond to them with compassion and self-awareness. The first step is just to notice and name your emotions, which is calming in and of itself because it validates and legitimizes your experience. To do this, we can use mindfulness, the practice of shifting our attention on purpose to be more engaged in the present moment while staying curious and not judging. Let's start with being mindful about our anxiety. Anxiety is a normal automatic reaction to our stressors in our environment, letting us know that we feel unsafe, insecure, or unsettled. Anxiety is uncomfortable and can be inconvenient, but it's not inherently bad, and is actually meant to be a helpful signal to us that we need to make a change or to take action. So there's no need to judge ourselves for having it. To practice mindful presence and curiosity about our anxiety, ask yourself, what in my body lets me know that I'm feeling anxious? Scan your body from head to toe and notice any changes or sensations there. Next, think about your triggers. Did something specific set off your anxiety? Like, is something you value at risk? Are you feeling vulnerable or incapable in some way? What could you be worried about right now? We often minimize our experiences, but this isn't as helpful as we think because we end up denying that we have any needs at all. Instead, ask yourself, what is it that you need today to feel better, safer, more confident, or more secure? And then seek that out. Tuning into our experience instead of away from it helps us think about our anxiety instead of from it. Doing this helps us regain our control of our thoughts and actions and prevents anxiety from running the show and dictating most of our life. To aid in restoring calm and control, try deep breathing, meditation, and movement of any kind. The key here is just getting out of your head, pressing pause on all those anxious racing thoughts, and getting back into your body to bring your heart rate down or get rid of any lasting tension. Once your body is calm, it's so much easier to think rationally instead of anxiously about your situation. If you're experiencing frequent panic episodes or significant distress or impairment due to your anxiety, it may be time to reach out for professional help from a doctor or therapist to learn how to better manage your anxiety. You don't have to keep struggling on your own when help is available. Unlike anxiety, depression doesn't always have clear triggers. Many different factors can be at play, including genetics, hormones, brain chemistry, change in season, stress, trauma, and lots of other environmental factors. But you can still get curious about what's going on and what you may need when you notice that you're feeling depressed. First, you can assess your experience by tuning into your body. What lets you know that you're feeling depressed? What feels shut down? How long has it been feeling this way? Think about intensity, duration, and frequency of your symptoms. Then consider if you're having a depressive response to a specific trigger or if you think that you may have a depressive disorder. To better illustrate this, let's look at loneliness and how it sometimes relates to depression. We've all experienced loneliness before. It's not just physical aloneness, but the feeling of being alone, feeling empty, misunderstood, disconnected, like you don't have anyone to support you or who you can really be yourself around. It feels a lot like depression because it often brings heaviness and joylessness along with emotional distress or numbness, but it's so normal to feel lonely, especially during periods of transition or in response to rejection, exclusion, or grief. These would be specific loneliness triggers to which we may have a depressive response to. We may feel lonely or depressed longer or more intensely than we think we should due to our culture's stigma around mental health, but it's a depressive response and it's common, and in time and with intentional actions to meet your needs for connection and belonging, it most likely will stabilize and diminish without turning into disordered depression. Loneliness for someone with disordered depression will be experienced differently. You see, a depressive disorder significantly impacts every aspect of your life and is sustained by a disordered system of acting, reacting, relating, and coping that will keep you stuck in a depressive cycle until that core system is healed. For example, someone with disordered depression may believe that they are lonely because there is something wrong or unlikable about them. This negative core belief may lead them to interpret and react to social interactions with a negative and very self-critical outlook. Without any positive reinforcement or support, they may continue to hide their feelings and avoid connections with others, disengaging from positive coping activities and other physical, emotional, and social needs, which then only makes them feel worse and reinforces their negative beliefs about themselves. And so the depression and loneliness cycle continues. When you notice yourself stuck in a depressive cycle, whether it's a response or a disorder, it's so important not to ignore it. Depression is treatable, but it is much harder to heal from the longer that you've neglected your physical and emotional needs. Here are some ways to meet those needs if you're feeling depressed. Seek out social interactions and opportunities to build strong connections with others who are similar to you, where you feel safe, supported, and able to share your experiences vulnerably and have them validated. Next, take care of yourself. You can't force yourself to feel happy, but you can prevent the cycle from getting worse. Stay active with some kind of exercise and get out in the sun as much as you can. Try to pay attention to your diet, appetite, and sleep schedule to restore a healthier balance. And keep tuning in to the things that you used to enjoy or found relaxing. Sometimes doing the opposite of what you feel like doing is the best thing that you can do for yourself in the moment. Next, let go of the things that are causing undue stress and pain, like perfectionism, toxic relationships, the weight of other people's expectations, and remember to challenge all your negative thoughts, looking for evidence against them and reminding yourself of your positive qualities and strengths. If giving yourself those words of affirmation is hard, look for an activity to build mastery in that will help you build your confidence, or do something that's others-oriented to gather positivity. Always remember to find compassion and curiosity for yourself and your emotions, and keep asking yourself what you need. Managing depression, anxiety, and loneliness by yourself can be really hard, and most of us weren't taught the skills that we need to do so growing up or in school. So don't be afraid to reach out to a mental health professional who is trained to help you navigate all your uncomfortable emotions and stuck cycles. You are not alone, and with the right information, skills, and resources, you are capable of anything.